Hello, it's Mark Chris from Memorial Sloan Kettering, speaking today from my home, being isolated and working from home by the request of my workplace. I know many of you are probably in the same position. I want to speak today about the treatment of people with cancer in this era of COVID-19. It's an absolutely extraordinary time. I fair to say that there is no precedent for exactly what's going on now. What's most unprecedented to me is the rate of change. Every day is different, and frankly, every part of the day is different, and it's going to remain so. It's given physicians a huge responsibility to stay current, and it's a whole new world about how that is going to be. Things changing so quickly. Obviously, it's a huge concern for all of our patients and their families. They already are facing a cancer concern. But one thing that I want to focus on today is for them, COVID-19 remains a possible concern. Cancer is a definite concern. And the outcomes of cancer, particularly the advanced thoracic cancers like the ones I deal with, they're very, very severe. The outcomes are sadly well known. And for our patients, they face this. And in some ways, the COVID is an additional concern, but their main concern remains cancer. Last weekend, the nurse I work with did the triaging for our institution and answered calls from patients and families. And when she finished that weekend of triaging, I said to her, well, you must be sick of COVID-19, talking about it with everybody on the phone. And she says, the people on the phone, the patients calling into our facility, were not asking about COVID-19. They were asking about cancer and the complications of their cancer. And I found that very, very sobering, and I found it grounding because it told me what our patients are really interested in. So please remember, cancer remains their chief concern. Our job just got a lot harder. With all the concerns we've been trying to deal with our whole careers in cancer, we suddenly have interposed on it the concerns, uncertainties brought on by COVID-19, both for us personally, for our friends, families, the staff we work with, and for our patients. Our job really, really has gotten harder. But I urge you to try to mentally think about it, that when somebody with cancer is speaking to us, their first concern is cancer, and we need to stay focused on that. And now we have to add in an addition how COVID-19 could impact their concerns on cancer. So one piece of advice, think cancer first, then think about how COVID-19 impacts on that person's cancer. That's where their heads are at, and that's where our heads should be at too. One thing we need to do now in this very, very complicated situation is to try to limit the distractions that we face. I know constantly there are emails flying, text messages flying, flashes on from health alerts, even from health authorities. But we need to kind of put them aside with the patient. So if it's anything like at my institution, at your institution, what's happening now, we're asked to make our visits less frequent. We're asked to make our visits shorter. So it's incumbent on us to work as hard as we can to focus on the patient, mentally get rid of the distractions, make sure we address the needs of our patient. And then when all that's done, we have to layer on how does COVID-19 affect their lives and how are we going to advise patients to do that. Please remember, at least for those of us that deal with thoracic cancers, by the nature of our illness, everybody's at high risk for COVID-19. Our median age is over 70. A huge proportion of our patients have a prior history of smoking and COPD and other smoking-related illnesses. So indeed, they are high risk, but frankly, they're no more higher risk than they are from their cancer, which already puts them at a horrible high risk for threats to their health and their life. So please remember, The cancer and its consequences remain the chief concern of our patients, and it should be our chief concern as well. And as we learn each new thing about this illness, we need to always put it into the context of cancer, make sure we answer our patients' concerns about cancer first, then how the COVID-19 impacts upon their cancer and their cancer concerns.